Bismillahirrahmanirrahim. Assalamu alaikum, respected audience. Today, the topic of my discussion is a complication of intracorneal rings, that is, corneal rings extrusion. We know that keratoconus is a corneal degenerative condition in which cornea thins in the center and it develops irregular astigmatism, and it keeps on progressing and leads to decreased vision. One of the treatments that has been carried out is intracorneal rings to control the astigmatism and flatten the corneas. These intracorneal rings are made up of PMMA, polymethyl methacrylate, and they are basically used to flatten the steeper axis of the cornea. These are crescent shaped structures which are passed and put inside the cornea depending upon whether the astigmatism is how much, it's different calculations. So this is one of the way of the treatment. Since years this is being practiced. Well, we know that there are many treatment methods for the management of keratoconus, starting from the glasses, hard contact lenses, cross-linking, and intracorneal rings. And ultimately, if the patient does not improve, there are many chances to go for the keratoplasty, which may be penetrating keratoplasty or deep anterior lamellar keratoplasty. So this is a procedure which is done if a patient is not tolerant to the hard contact lenses. So it can be tried before going for the keratoplasties. Well, in market, different types of rings are available. The name of Intacs, Cara rings, Ferrara rings, and they all have been used, and they all have their own pros and cons. For example, if you talk about the Intacs, these are hexagonal in shape, and they are usually placed in the mid-periphery. You can say initially they brought Intacs rings which was placed in the 7mm zone, and now with the SK Intacs they are coming towards the 6mm. While on the other hand, if we talk about the Cara rings, these are triangular and they are positioned much more central to the visual axis. They are more effective, but at the same time the problems which can happen is in the broad daylight when the pupil gets constricted, and photopic phenomena can happen, glare like this. So, but these are relatively more effective as the rings go towards the central area. So as I already mentioned, that these rings only have effect on the mechanical aspect. They do not interfere with the degenerative process. Just mechanically they are going to flatten the cornea, its conical shape. Otherwise the disease process which was there, it does not interfere with that. There can be many complications also with these rings, like any surgical procedure, starting from infection, and these rings can even migrate into the anterior chamber, and sometimes they can cause the melting of the cornea and extrusion. And these extrusion problem which we are going to discuss is mostly encountered if the tunnels and the tracks are made mechanically as compared to the femtosecond laser assisted procedures. Secondly, if the ring end is very close to the incision site, or very loose sutures have been applied over there, then there are chances that the ring may extrude outside, and it may develop corneal epithelial defects due to the necrosis of that specific area. So today our case is about the patient, 25 years old patient who has already undergone cross-linking 4 years back, and he still had progressive keratoconus. Vision was 20/80 both eyes with pinhole, and subjective refraction was -7, -3 right eye, and -9, -5, 5-degree axis in the left eye. So this patient underwent once again Intacs plus topo-guided therapeutic keratectomy, surface ablation to remove the scarring over there, plus cross-linking. So all these three procedures were done in this patient. So if we look towards the corneal topography, the pentacam of this patient, we come to know that the Kmax was 69.5. Thinnest location of the cornea was 421, and the flattest meridian was at 137.8 degrees. So if we look at about the cone, it looks asymmetric, as more than 50% of the cone is outside 3 millimeter zone. So as I mentioned, this patient had the astigmatism of 5 degrees. So in such situations, we have to follow the criteria of Intacs for the rings, which are asymmetrical. I mean, for the superior and inferior are different. Usually inferior, the rings are more thicker, and superior the thin. And in this patient, which I'm going to talk about, the incision site was almost 47 degrees. You can say the steeper meridian. So at that point, the incision was made and the rings were placed. This is the OCT anterior segment, and it shows the femtosecond laser assisted the tunnel which has been created. Its location is very much evident in this slide. So this is the corneal pachymetry. You can see here that the place where the inferior intracorneal rings are placed, at there the thickness is 524. This is the other slide showing the location of the superior ring, and here the pachymetry is 617. So in the both rings, the surgeon has perfectly taken the right places for the rings placement. So it was very good to place it at 617 degrees pachymetry. So he placed over there superiorly. This is the pachymetry of the central zone, where the cornea has got thinning, and it has gone up to 467. This is the thinnest location. It's very much evident over there how it is bulging forward also. So after 2 months, as I told you, the patient presented in emergency, and his vision was 20/30 both eyes, but he had corneal epithelial defect at the insertion of the ring site, wound site, and the superior ring was extruding outside. So in such situations, when the patient comes into the emergency, we start our usual treatment, the antibiotic coverage, and to see any involvement of any infection that were carried out, and the patient was closely monitored. So this is the corneal photograph at the time of presentation. Here you can see that the blue circle is that place where the superior ring is extruding out, and you will see that inferior margins of the ring have almost more than 2 o'clock gap, but superiorly they're almost touching it. So this was the problem over there that happened, shown in the blue circle. So this is another angle showing the location of the extruded ring, and it was taking minimal stain over there, no infiltrates, no hypopyon, no infection, but just extrusion outside. And these things a source of possible infection later on and corneal melting, and they have to be managed because extruded over there it will cause constant pain and discomfort to the patient also. So this is another slide of the same patient. So this patient was managed and the extruded ring was removed, while you can see the blue arrow showing over there, and the inferior ring, which was not yet extruding, it was closed with a stitch. It is shown with the blue arrows, while the left side is shows how the cornea is bulging, keratoconus, you can see over there. So this is the latest photograph of the patient. He is being monitored, still managed. And you can see the inferior ring is well stitched, closed, and it still has minimal staining over there, while the superior ring, which was removed, that area has healed, but there is still some mild corneal edema, mild ciliary congestion, no signs of infection. So this is a possible complication of intracorneal rings. But how it can be prevented? This can be prevented if we use femtosecond laser assisted tunnels. The rings are placed properly and they should be away from the wound site. If they are very close to wound site, this complication can happen. And number two, the wound should be closed properly, well stitched, because if the stitching is loose, this is a source of new vessels and ultimately leading to inflammation and corneal necrosis and CEDs, because this keratoconus is not a normal healthy cornea, it is already a sick cornea. And one thing very important, whenever we put the rings, the gap should be at least 1 o'clock between two. If they are very close, these things can happen. Well, this is one of the potential complications, and it should be managed on urgent basis, because if further delayed, these things can lead to infection, corneal melting. So this was a case I wanted to discuss with my respected audience, that how this complication, the corneal rings, which is a very effective way of treatment, keratoconus, can have these complications if they are not anticipated before. I want to thank my respected audience for their attendance and attention. Thank you.